Welcome to the Classroom to Care, C2C project update. Over the next 3 years, IntraHealth International will strengthen the pre-service training of midwives and nurses in 12 private health schools in Mali, Niger, and Senegal. IntraHealth has provided high-quality technical assistance to developing countries for decades, including the human resources for health-strengthening activity in Mali. C2C builds on this experience and leverages our strategic partnerships. Through targeted interventions at national level and within the 12 schools, we are contributing to improve the quality of education and healthcare services in Senegal, Niger, and Mali. Our efforts include capacity building, updating of national texts and policies, and the implementation of best practices in diversity, equity, and inclusion, DEI. There are 4 main objectives of the Classroom to Care, C2C project: strengthening pre-service education, PSE, to improve the quality and availability of midwives and nurses through updated competency-based curricula, supported by practical teaching aids and digital learning tools with support from Empower School of Health. Establishing strategic partnerships with regional bodies, such as the West African Health Organization, as well as private school associations within each country. Training teachers, supervisors, and site coaches in modern teaching methods, such as competency-based approach, CBA, and other adult learning techniques. Increasing the number of graduates from marginalized communities, vulnerable groups, and low-income sectors by implementing DEI best practices. Our methodologies include situational analyses, the establishment of national technical working groups, and the development of DEI strategies tailored to each country's context.
Nous sommes là dans le cadre de ce projet qui va accompagner ces écoles pour les amener vraiment à pouvoir former un personnel infirmier et sage-femme de qualité. Et on accompagne ce projet dans le cadre de la mise en œuvre du programme de l'OAS. Ce programme-là de déroulement des cours aussi bien théoriques, pratiques et au niveau de l'encadrement clinique. C'est pour les écoles privées, mais l'école publique aussi en bénéficie parce que quand vous allez dans une région, c'est les mêmes enseignants vacataires, les mêmes enseignants en général qui encadrent les étudiants sur le terrain, les mêmes encadreurs. Donc, par ricochet, les autres écoles en bénéficient.
We extend our heartfelt gratitude to Takeda for their generous funding, a total of 953 million Japanese yen, $8.9 million. In year 1 and 2, funds have supported the development of 12 capacity building plans to address gaps in national accreditation standards, the purchase of essential teaching equipment for the competency labs, and the development of a learning modules of the West African Health Organization harmonized curriculum. To fully appreciate the early results of the Classroom to Care project, it is crucial to understand the historical context and the challenges that necessitated its creation. The project emerged as a response to several pressing issues like the lack of qualified health workers, especially in rural areas where there is a significant shortage of qualified nurses and midwives. Many health training institutions are inadequately equipped, affecting the quality of education. Challenges have arisen in forming partnerships between private and public health schools and in cross-sectoral collaboration between the education and health sectors. C2C aims to address these issues and more through strengthening 12 rural private health schools to increase the number of qualified nurses, particularly in marginalized communities. We're also collaborating with the public sector on accreditation and curricula, while integrating DEI best practices to reduce attrition rates in schools.
L'un des objectifs majeurs, en tout cas, que C2C nous a dit de travailler en commun avec eux, c'était justement d'amener tous ces établissements à avoir une accréditation double. D'abord au niveau national, puis de les accompagner jusqu'à avoir une accréditation au niveau international, donc au niveau du CAMES. C'est comme un appui aussi pour nous. Parce que l'objectif pour nous, c'est d'amener tous les établissements bénéficiaires d'une accréditation. Et si eux, dans leur démarche, ils ont ce volet d'accompagnement des établissements, c'est un plus pour nous et qu'on est ravis en tout cas de la collaboration.